What is hemostasis in diverticular bleeding? Imagine a small tear in a tiny blood vessel inside your colon causing bleeding. Hemostasis is the body's natural process to stop that bleeding quickly and safely. When diverticular bleeding happens, it means a small pouch in the wall of your colon, called a diverticulum, has a blood vessel that has ruptured. This can lead to noticeable bleeding from the rectum, which often prompts urgent medical attention. In medical settings, doctors work to control this bleeding using techniques that are minimally invasive and highly effective. During a procedure called a colonoscopy, a doctor inserts a flexible tube into your colon to look for the bleeding source. Once they find the bleeding diverticulum, they can use several methods to achieve hemostasis, or stopping the bleeding. One common method is endoscopic clipping. This involves placing tiny metal clips directly onto the bleeding vessel or the opening of the diverticulum. These clips act like tiny staples, mechanically closing the vessel and stopping the blood flow. Another technique is endoscopic band ligation, where a small rubber band is used to suction the diverticulum and tie it off. This effectively seals the vessel and prevents further bleeding. Sometimes, doctors use injection therapy, where a special substance is injected to promote clotting, or heat cautery, where heat is applied to burn and seal the bleeding vessel. Recently, new approaches like applying self-assembling peptide hydrogels have shown promise. These gels help from a clot and seal the bleeding site, reducing chances of rebleeding. The choice of method depends on how severe the bleeding is, how clearly the bleeding site can be seen, and the patient's overall health. Endoscopic hemostasis is preferred because it is less invasive than surgery, provides immediate results, and allows both diagnosis and treatment in one procedure. Stopping the bleeding quickly is crucial because it prevents ongoing blood loss, reduces the risk of recurrent bleeding, and stabilizes the patient. If bleeding continues or recurs, more advanced interventions might be needed, including surgery. Diagnostic tools like Doppler ultrasound during colonoscopy can help identify signs of recent bleeding, such as visible vessels or clots, guiding targeted treatment. In summary, hemostasis in diverticular bleeding involves using specialized endoscopic techniques to mechanically or chemically stop bleeding from ruptured vessels in the colon. This approach is aligned with current medical standards and helps manage acute bleeding episodes effectively, reducing the chance of future problems. Always remember, if you experience symptoms like rectal bleeding, consult a healthcare professional promptly for personalized care and advice.